Center. Thank you so much for joining us this evening. Before we dive into our discussion on fertility, for those of you who are new to our community, I wanted to let you know about our center as well as tell you a bit more about our speakers. Yinova is an integrative wellness center acclaimed for its expertise in fertility and reproductive health. With 3 clinics in New York City and virtual services for people around the world, we work in partnership with our patients to realize their full potential. We offer acupuncture, Chinese medicine, bodywork, and virtual consultations from the field's leading practitioners. Dr. Jill Blakeway is a renowned acupuncturist and herbalist, celebrated author, and the founder of Yinova, where she's been treating patients for over 2 decades. Jill's always been passionate about supporting people's reproductive health and fertility, so much so that the New York Times described her as a fertility goddess and named her as one of Manhattan's top acupuncturists. She credits much of her success to combining the ancient wisdom of Chinese medicine with modern conventional biomedicine. Anne Brunn is an acupuncturist and herbalist who joined Yinova more than 10 years ago, bringing with her a breadth of experience stemming from the background as an artist, business professional, and yoga teacher, as well as a lifelong pursuit of holistic wellness. She has particular expertise in fertility and reproductive health and has taught women's reproductive medicine from an Eastern and Western point of view to acupuncture students. Over the years, she and Jill have collaborated often on patient cases, and Anne is also the leader of our fertility coaching and support group. Thank you to everyone who submitted questions prior to this discussion. I'll start with some of those, but if you have questions throughout, please feel free to add them in the chat box or Q&A section, and I can read them out for you. And with that, I will pass this off to Jill and Anne.
Well, thank you, Emma. That was a lovely introduction. And I want to say what a joy it is to do this with Anne. Anne and I have worked side by side, as Emma said, for over a decade. She's a fabulous practitioner of traditional Asian medicine, a herbalist and an acupuncturist. And when I persuaded her to lead our coaching and support group, I could think of no one better because she has such a breadth of knowledge about how to get pregnant. And one of the things we thought about when we were creating this coaching and support group is we wanted to give people support, but we wanted to move people forward and give them lots of information so that it was empowering. And Anne, of course, was the perfect person to do this. And we've had several support groups go through now. And one of the things I love is that our first ever group became so attached to each other that they continued to meet without us once the coaching group was over. It normally lasts 8 weeks, doesn't it, Anne? Isn't that normally?
Yes. And they're still meeting, many of them are meeting weekly, and several of them are pregnant or have had babies. So
this is all very exciting.
Added excitement. Yeah.
And so we gather you together in these small bonded groups so that you have like-minded people to talk to, but it's a limited commitment. It's normally 8 weeks. I think we have a quickie in the summer that's just 3 weeks, that starts quite soon. But it's really to give you some of the tools that we have that sometimes your doctor or us don't have time to tell you, and so we can go into detail about how to enhance your fertility that way. And people do love it, don't they, Anne? People get a lot of information.
Yes, they do. Even when they've been on this journey for a while and they think, they've been through everything and they've been hearing about what they're supposed to do to track their cycles and how they're supposed to eat and all this basic information. Many times they learn something new, either from what I'm talking about, with them in the group, or from what other people contribute, because everyone who comes in has a different, aspect of the experience to contribute. And so they all learn from each other too. And I learn from them, which is kind of a fun part for me as well. But yeah. And it's the groups get along really nicely, and everybody has things to bring, and it's always a fun and interesting time. And we have some guest speakers too, generally, which is a big contribution for it.
Well, we thought that this evening, Anne and I would answer some questions. It's always popular with people. And I realized that, it's easy for us to answer some questions. We do this all day, and we love to share our information with you and help you. So Emma, I know that you had some questions sent in advance, and I can see that we have some questions in the Q&A as well. So I'm going to let you choose where we start.
Yes, it's hard to pick. Maybe we'll just start with some of the ones that were sent in. I like this one because I haven't heard it phrased this way, but I think that this will be an interesting one to answer. So someone asked, will I get addicted to acupuncture? So for example, if they use acupuncture to get pregnant, will they need to get acupuncture throughout the whole pregnancy? Otherwise it will be bad. So what are your thoughts on acupuncture addictions?
Well, actually, I saw that in the Q&A, and thank you for the question, Grace. I think that's a good question. No, the answer is no. We actually don't aim to make you dependent on us. That isn't our aim. Our aim is to get you into a different place. If your aim is to get pregnant, our aim is to help you, and you won't suffer any consequences by stopping acupuncture, which is, I think, what you're asking. Like, if I start, will I be able to stop? The answer is that, we'd like to help you get pregnant. And then acupuncture is useful during pregnancy. And a lot of the time with my patients, once they get pregnant, I sort of leave them on their own reconnaissance. And I explain what acupuncture can and can't do during pregnancy and say, come in if you need me. It's a good first line treatment for a lot of the common pregnancy ailments, particularly morning sickness and fatigue and foot swelling and all those things that sound worse than they are, really. So we're here for you, but no, we're not going to get you addicted to us. In fact, we'd like to help you stand on your own 2 feet, and we consider a patient well once they don't need us anymore. Don't you think, Anne?
Yes. I mean, I was just thinking about the point of acupuncture is really to help your body get to its healthiest place, so that we can help you, wherever you might need to be nudged along to help you get pregnant. But then your body is doing the work it's meant to do, and we can help support you while it's doing that. As Jill mentioned, we can help you manage some of the symptoms. And every time you have a treatment, it is helpful, and also the effects are cumulative, but the idea is to put you help you get to a place where your body is balanced and is kind of leading the way, and really keeping you supported. I mean, the only thing I wouldn't use the word addicted, that you can become so happy about that you don't want to do without, is how good you usually feel while you're lying there for a treatment and after you leave. But that's nowhere near an addiction. It's just a side benefit. Yeah.
Yeah, you get a little endorphin release when you have a treatment, and it's not the only way that acupuncture works by any means, but people get into a sort of blissy, floaty place, which they like a lot, but it's not addictive. Good question, Grace. Thank you. Emma.
So I'm going to jump back to some of the question that was asked before this, but I do see the other one, and we will get to that. Someone else also asked about ectopic pregnancy, so I'll cover both those questions closer together. But one person, and I know that actually in the fertility support group, that cervical mucus is a main topic. And so someone was wondering, how can I best use cervical mucus to time intercourse for conception? And wondered what your thoughts were on, cervical mucus.
I'm going to let Anne go first, because I bet she's a whole class on cervical mucus.
I do. I pretty much do have a whole class on that. And it is a great question. What you want to do is the best thing to do is throughout your cycle to pay attention to what your cervical mucus is doing. Some women have a lot throughout their cycle. Some women don't have much, but during the ovulation process, that's when the cervical mucus is the fertile mucus is that slippery, we call it egg white quality. It's kind of clear and a little on the slippery side, instead of thick or creamy or anything like that. There are ways to do it. Sometimes it's plentiful. Sometimes you need to check your cervix really to find it. We talk to you about how to check your cervix for that. I will give you a little acronym that goes along with how the cervix is helpful in that, and it is S for soft, your cervix is soft, H for high, your cervix is higher up than it is in the rest of your cycle, your cervix is open, O for open, and W for wet, so it's SHOW, your cervix will show you when you are ovulating. It's a really simple little trick. I'll tell you more about it in the group, but when you find that you are noticing that cervical mucus, that's the beginning of your fertile period, and that's a good time to just start having intercourse on a regular basis.
And I'm going to add that your most fertile day is usually your last day of egg white cervical mucus.
Mhm.
And I just mentioned that because people tend to have a consistent amount, like they tend to have 3 days a month or 2 days a month of the egg white cervical mucus. And so it can help you plan in some ways. If you know that you consistently have 3 days of egg white cervical mucus a month, you can plan when you see it to have intercourse on day 3, and that will usually be your most fertile day. And so more people have got pregnant because I've told them that than a surprising number of people have got pregnant because I told them that. So I thought I should add that in. Good question.
Yeah, that's great.
I'll add one more thing, which is some women have come to me and said that they don't see very much, or they don't really notice that they have any. And we can work with you for that also with herbs and acupuncture, and we can have some conversation about diet and that sort of thing that will be really useful to help you generate some more fertile mucus, which can be really helpful for conception.
And also just know that there are fertility-friendly lubes, sexual lubricants on the market. We stock one at Yinova. You can see it in our Yinova store online. We stock a natural one, and they are quite specialized. Normal sexual lubricants are a little inhibitory to sperm, so we discourage them when you're ovulating and trying to conceive. But these ones replicate as near as possible egg white cervical mucus. So if you're in any doubt, I think you should treat the root and get to the bottom of why you don't have cervical mucus, and that's certainly what Anna and I would do in the clinic. But you can also use a fertility-friendly lube, and that often solves the problem. See, we have a lot to say. We could honestly do an entire session on cervical mucus, Anna and I, but we'll get you to ask another question.
I love that. I haven't heard that acronym of SHOW. I think that's so helpful and easy to remember. Thank you. So someone had sent in a question saying, for months I've relied on the assumption, also made by my doctor, that the issue with my fertility was most likely my age and stressful job. How do I approach my fertility efforts after learning that there are actually issues with my partner's sperm?
Yes. You know, this happens a lot, and it's why people like Anne and I, who've done this a long time, we encourage people not to just accept that they're old and have old eggs. I mean, reproductive medicine makes everybody feel ancient at the best of times, but it's often, when I think of why people don't get pregnant, it's often quite a few things ganging up on you. It's not one thing rendering you infertile. It's lots of little things making you subfertile. And one of them wouldn't be a problem. But when you have several, they start to be a problem. And so, you know, as you get older, you have variable egg quality. And so that slows you down. And then if you don't do any more digging, you don't find the other things to solve. And we always encourage good diagnosis for that reason. And so, you know, a male factor issue also is slowing you down, is how I think about it. And therefore we have to tip the scales back in your favor. So we would do lots of things to help nourish every egg and make sure they live up to their potential. We need your partner needs treatment of some sort. There are lots of reasons why the semen analysis is considered not within normal limits. You know, it could be the sperm count. It can be how well they swim, the motility, and that gets split up into whether they have a sense of direction, because some of them have endurance but just go round in circles, which is not, so whether they have endurance and whether they have a sense of direction, morphology, which is the shape of the sperm. And at Yinova, we give men herbal formulas to correct a lot of those imbalances, but it takes a little bit of time, which is always frustrating. Men make new sperm every day that come into fruition in 3 months. And so it takes 3 to 6 months to change a man's reproductive status, which, you know, if you have if you're getting older too, and then that starts to be a little bit of a problem, although circumventable with, you know, assisted reproductive techniques and things like that. But you are flagging a common problem, which is that if the temptation, if there's one issue, is to just look at that one issue. And fertility is such a holistic issue between a couple that it's really important to look at both of you, and I just see it as upping the odds.
I agree. Also, to really be in sync with each other in terms of, first of all, not naming it as blame or something. It's your fault or it's my fault. It can be a combination of two people, both of you needing to make some changes, some adjustments, some improvements. And I think, it's really great when you are starting to do the same eating plan and the same lifestyle. Make sure you're adjusting your sleep habits and your exercise habits. And because, studies show that men respond really well to changes in diet and changes in lifestyle habits and improved sleep and that sort of thing. And their sperm quality in tests is shown to be better when they are changing habits in that way. And for most of us women, it's good to do the same thing. And evaluate that. So if the two of you are doing it together, it's going to really support the process that much more.
And there are some excellent male prenatals on the market. We stock one in the Yinova shop, but there are plenty on the market. A good sort of nutritional supplement, I think, is a good place to start. And depending on the issue, some herbs would be a great idea. And Anne's right. The downside is that men take 3 to 6 months to show improvement. The upside is they can show improvement. They can change their reproductive status completely in that time, which is the good news. And I was actually just interested, as you spoke, Anne, and you were just talking about blame. I'm assuming that comes up in group, because that comes up with my patients, is that feeling of shame or insufficiency. And I just sort of wanted to address that.
Yeah, it does come up. I think, there a lot of women talk a lot in the group about their own feelings of shame about not being able to get pregnant, not being able to fulfill the dreams that the couple has. And it's really, it's powerful and it's painful. And then sometimes it gets shifted because the men feel guilty or less than, virile or something like that. And it really is, it's so common for couples to struggle with fertility. And we know that at least a third of them have all male issues, or roughly a third of them have all male issues, and many of them have a combination, as you were saying, issues. So to be able to reframe it so that it's not a fault that belongs to either one of you, it's simply a process that you're going through and something that you can both work on and support each other with, and not consider it something that is somebody's problem, somebody's negative contribution to the process.
Thank you. Emma.
Yeah. So a few people had asked about ectopic pregnancy, so I wanted to just cover that. I wondered if you could tell everyone what that is, in case people haven't heard of ectopic pregnancies before, and then wondered if you could speak to how acupuncture and herbs can either help prevent that from happening, or if it has happened, if it can be helpful in the recovery and also in preventing.
And do you want to start with explaining what an ectopic is?
Sure.
And then
an ectopic pregnancy is a pregnancy that takes place outside of the uterus, typically inside the fallopian tubes. So generally speaking, in a natural conception, I'm sure you all know this, but I'm going to just talk you through it anyway. The egg is fertilized in the tubes, not in the uterus, in the tubes, and it makes its way down through the tubes and implants in the uterine lining. In an ectopic pregnancy, it doesn't make its way, generally speaking, doesn't make its way all the way to the uterus, but it starts to grow instead within the fallopian tubes. It cannot survive that way. It's not viable. And it can be very dangerous to the woman if the tube bursts open, because the growth happens too long before it's detected and managed. So generally speaking, there is surgery or there are medications that can resolve it, but it's not a viable pregnancy, and it's something that can happen. There are a few kind of situations in which it happens more easily, if there's a lot of scarring, if there have been previous ectopic pregnancies, few situations which might be more likely to create it, but very often, there's no particular expectation that it's going to happen.
and I saw this question from Ricky, and I hear that you have several of them, but Ricky asked about what to do afterwards to prevent for any potentially partially obstructed tubes. So, Anne was mentioning that when you have an ectopic, and I'm sorry that this happened to you, Ricky, incidentally, it's both painful and really disappointing, and it's a hard thing to go through. The first thing that your doctor will do is try and preserve your tube, and they usually give you a chemotherapy drug, actually methotrexate, which sounds scary but isn't really. It's a one-off dose thing, but they're just trying to stop the cells from dividing and it growing, and that's the way they save the tube. And at that point, I think the first thing to do after that is actually to check whether your tubes are open or not, rather than guess. So you should have an HSG once you've recovered and see if they're open or not. And then how we treat people is we promote blood circulation in that area. We do things that reduce inflammation. Yeah. And you talk about unblocking a partially blocked tube. We don't, acupuncture can't unblock a tube, as far as I know. I haven't ever been able to do that, but I have seen bodywork be able to do it sometimes. We have reproductive massage therapists at Yinova. We can teach you. You can have an online bodywork session, believe it or not, and we can teach you how to massage yourself. And there are also specialized physical therapists who do exactly that kind of thing. There are herbs that are sometimes used to address it, but I'm not completely confident that they work for everyone. Actually, I've seen them work. I've seen them work sometimes, but I don't know whether it's the herbs or whether the people's bodies are very intelligent and they start to clear debris, in fact. So we would give you acupuncture to promote blood circulation and reduce inflammation. We would give you herbs similarly alongside a herbal formula, is part of a herbal formula that also helps your hormones to recover from an ectopic pregnancy. And we would probably refer you to one of our massage therapists to have abdominal massage to get everything moving. What do you think, Anne? Is that about?
Yeah, it is. And I would just also, aside from inflammation, I would talk about the acupuncture and herbs helping to prevent scarring also.
Yes.
Yes.
Which is really important. Yeah. And that I think we can be very confident about saying that we're good at.
Yes. And moxa, use of moxa is very good for that too, which is a topical herbal treatment that we use in the treatment room. It smells a little bit like a combination of sage, incense, and marijuana together. So don't worry, we're not smoking if you smell it in our hallways, but it's really useful for healing tissue and keeping the circulation pathways open.
And it's been used for thousands of years, moxa. We burn it above acupuncture points. It's a herb. But when it's looked at in clinical research, it has extraordinary infrared properties. They've shown that it penetrates, the heat from the moxa penetrates much deeper than just heat held above an acupuncture point.
And more directly, yeah.
Yeah, it's actually very interesting stuff. So yeah, we would use lots of moxa, very warming and moving, that kind of thing. I hope that answers your question.
Thank you. So we had a question, I'll just read it out as it was written. So does female masturbation during or after intercourse interfere with implantation? And then my own add a bit, or maybe even it could help. I don't know, but would love to hear your thoughts.
You're absolutely right, Emma. It can help because orgasm promotes blood flow, and that seems to help implantation at that point. And so I didn't write about this in Making Babies because orgasm is a difficult subject, and I didn't want people to feel like if they didn't orgasm, they wouldn't get pregnant, because that's not true at all. But that it does seem to actually, female orgasm seems to help with implantation, and that's what the science shows. So the answer to that question is go ahead, I think.
Thank you. So Another question. So back to Anne, when you were mentioning the show, your cervix will show you. So someone asked, is it possible to assume you're ovulating based on the show signs, even if you're not getting an LH surge on OPK tests?
Such a good question. I'm not entirely sure how to answer that. I think what I would probably want to ask you about is, for one thing, are you noticing cervical mucus? Are you seeing a consistent pattern in your cervix? And how are you testing your how are you using the OPKs? When do you start testing? And also, how are your cycles? How regularly? So I would do basically a kind of Q&A from start to finish about your cycle length, when you think you're ovulating, what other things you're doing to track it, if not, and also maybe have you do your basal body temperature, and then we might be able to answer that a little bit more clearly. What do you have to say about that, Jill? You might have
Well,
more.
I think Anne's right. I think we'd have to know a lot more to know, but it is technically possible. It's rare. It's very rare, but I have seen it for people to have the signs of estrogen building, which is like cervical mucus, and really the show signs are all signs of estrogen reaching its peak in some ways, and its effect on ligaments and things like that, and then not ovulate. But I honestly, I've done this for 20 years and I've seen it very rarely, but I have seen it. So our first thing would be to check that your the pea sticks, in fact, because some of them are quite confusing. And I always tell people this: the cheaper ones end up being less confusing. It's like in order to market more expensive ones, they add a lot of bells and whistles, and the bells and whistles make it very confusing. So I like the ones with 2 lines, because you can see your LH building, and even if it doesn't get to the point of being the same color as the control, I think as you see LH building, you're going to ovulate. So my first thing would be to check that we're doing the pea sticks properly and getting a proper result. And then I agree with Anne, I'd want to see a BBT chart, and but my guess is 9 times out of 10 you're ovulating and we're just not catching the LH surge for some reason. Thank you, Emma.
So someone just shared with us that they had recently gone through a miscarriage, and before I read the rest, I'm sorry that you went through that. So their doctors said that they can start trying to conceive again after their next period, but they were wondering when her and her husband can have sex again, aside from trying to conceive, as there isn't a lot of information about that online. Do you have any advice?
Do you want me to go first, or would you like to go first there, Anne?
Go ahead. I will.
Well, I'm really sorry. Miscarriage is much more devastating than people understand if they've never had one. And yes, there probably isn't a lot of information about when to have sex again. You need to wait until you've stopped bleeding, and then I would give it a week. You don't need to wait. It's not, you don't need to wait much longer than that. That first cycle after your miscarriage will be a peculiar cycle, and it's rare to get pregnant on that cycle, although it can happen. So if you don't want to get pregnant on that cycle, take precautions, but it's relatively rare. And then the next cycle is usually more normal. But would you agree, Anne? Or
I would agree. And also just to make sure, that there's no pain. If there's any pain, you would stop and everything. So let your body kind of dictate those signals. I think, if it depends a little bit also on whether you had a miscarriage where you bled spontaneously, or whether you had to have a D&C. There might be a little bit longer healing process from a D&C. But I would agree, once you're not bleeding anymore, and certainly a week after that, then chances are the uterus is pretty well healed, and intercourse will be fine. But, if you're having a little bit of bleeding with sex, certainly if you're having pain, you might want to just let it wait another few days or week.
Yeah, your body will tell you. And I know that after a miscarriage, you start to lose a little bit of faith in your body, but
Yeah.
your body's remarkably smart, actually. And your body will reestablish rhythm, which takes an enormous amount of awareness of what's happened. And so you can trust your body, and you'll be able to feel it, in fact, when everything's okay. But basically our message is wait a week after you stop bleeding after a natural miscarriage, possibly wait a little bit longer after a D&C.
And you won't be doing yourself any harm, even if you do find a little spotting or do feel some discomfort. You're not going to be hurting yourself. It just may mean that you need a little bit more healing time.
Yeah.
Someone had also asked about, again, after miscarriage, when to start trying to conceive again. Is there an advised time period to wait before trying again?
Here, I would say, as long as your hormones are back to normal base levels and you feel healed, I would usually wait a cycle to let, because as Jill said, especially you're probably not going to have a very normal for you cycle that month after you have had your miscarriage. So let your body go through its readjusting, let your hormones get back into their cycle, which they will understand how to do. And then sure, you can try again, as long as you're feeling good and there are no leftover issues, from any kind of complications.
Traditionally in Chinese medicine, the advice was always to wait 3 months, 3 cycles. At Yinova, we use that as a guideline, but we don't stick by it necessarily because a lot of our patients are older, and 3 months is a long time to wait. If you're reproductive status is sort of dwindling a little bit. So we take it as a case by case thing. And we usually just look at you and see, your body will tell you, some people have a miscarriage and literally a month later their period arrives and they just back into their cycle. And some people have some disruption. And so we treat you on a case by case basis. And if you had a lot of hormonal disruption, then our focus would be calming that down. And you stand a better chance of a successful, healthy pregnancy once your hormones are sort of back to normal.
And I would, in line with that, also say that it depends on how far along you were and what the circumstances with miscarriage, all that gets factored in. So, it's hard. Very often our answers will begin with, it depends, because everyone is different. And we, one of my colleagues says that all the time too. It always means, always starts with it depends. We really need to look at each case individually, see what your circumstances are. And then we'll help guide you to a path that you feel really comfortable with and we feel safe with.
And you can do that either in group with a small group of people or in an individual session with us, but we would look at you. You're right. A lot of answers start with it depends. It's true when it comes to fertility.
Yeah.
Emma.
Thank you for both of those answers. So someone asked, and I'm excited to ask you both this because I know that Chinese medicine has an interesting take on this. So they were wondering if you could explain what unexplained fertility really means. So this person in particular says, all tests were normal, but I failed IVF 3 times. So in your experience, what is unexplained infertility?
Anne, you go first.
Well, I'll try to explain it. First of all, may I make one shift in the language, and that is failed. I don't like to, I just, in my answers, I try not to refer to things too often as failed cycles, failed transfers, and that sort of thing, because I understand, that that's the term that medical doctors use. But, if something is not successful or doesn't yield the results that we're looking for, it doesn't yet mean that it's a failure. It means it's part of a process. So thinking along those lines, unexplained infertility is that, the way I look at it is that part of the body's processes that, while we know so much about how they're working and why and what the intricacies are, there are things that we can't explain. I think unexplained infertility means, again, even the word infertility, you haven't yet had an opportunity to be pregnant, but it means that according to all the standard measures for testing hormone levels and any kind of causes for not being able to conceive, there is nothing that they can identify. So, what we do is work with, again, examining every aspect of your cycle and helping you understand, if everything is working really optimally. Sometimes it may come down to, circulation not being as optimal as it could be, which there's no test for. Sometimes it's some levels of inflammation that they're not recognizing, that it's not really visible in the tissue. So it can be very, very subtle. But my understanding of unexplained is just that there's nothing that is testable that answers that question of why it hasn't happened.
And it's very frustrating to not have an answer, although better than having something really difficult to deal with. But it is frustrating. And I just want to add, I talked before about things ganging up on people. A lot of unexplained infertility is lots of little things that just start to gang up on you, none of which would make you infertile if they were on their own. And so if someone comes in to me with unexplained infertility, I do a bit of an inventory. I do detective work and I try and solve all the little things, and bit by bit. And that has, in my experience, usually worked. And I'll never know which part of it worked, really. I just, I set about helping people address digestive problems, even in case they're not getting the correct nutrients because their digestion isn't working properly. Or, this is a time to take a whole look at you. Your body has a whole awareness that is a coherence to it. And it's the part that we just take for granted, which is that our bodies, without us ever having to think, are constantly calibrating and recalibrating and synchronizing, and that requires intelligence. And so if anything is out, it can push other things out. It's like a big feedback system. So this is a good time to take a whole look at you. And I just try and fix anything that looks a little out. And that has usually worked. So there is hope. Just because nobody gave you a real reason doesn't mean that there isn't anything you can do. There's lots you can do.
Thank you. So someone asked, how long does it typically take for someone to notice improvements when taking Chinese herbs? For instance, if you're taking herbs for long follicular phase, low progesterone, etc., what are some of the marks that people can look out for when taking herbs?
Anne, you go first on that one.
Okay. Well, I am going to say it depends because in part, sorry, but it does. So precisely what, so what is the issue? What are we looking at? I would also, in this case, for example, you mentioned a long follicular phase. We would look at the whole cycle and say, when does it look like you're ovulating? What are the signs? How long is your luteal phase? So is that whole kind of cycle disrupted by a longer follicular phase, or does everything else seem in motion? Also, again, to take a whole snapshot kind of your health in general, see how the quality of your blood seems to be in terms of how it's circulating, and what about the rest of the processes in your body. It's hard to say. I usually like to tell people, when you have a situation like that, I usually like to say, we want to see you for 3 cycles. And generally speaking, we will see changes in that cycle. Sometimes we'll see major changes, but that also gives us enough time to see that the shifts we're making become a more fixed part of the corrected pattern. In other words, we start to make these little adjustments, and then by around 3 cycles, we see that things are happening on a longer term basis. So we might have actually corrected or adjusted the time of ovulation in a way that then you can rely on going forward. So 3 months is kind of the formula, and then it may vary according to what the reasons are and what the particular manifestations of the issue are.
So I agree with Anne on the 3 months, but I think this is a really good question, because if you're taking herbs, how do you know if they're working? I think it's a very good question. And, for what we do is we set short-term goals as well as long-term goals. If you're taking herbs to enhance fertility, obviously our long-term goal is that you get pregnant, but there are lots of ways that we can measure milestones along the way. And I usually, when I do an initial intake, I start to set those short-term goals and I share them with the patient so that we know where we're going and what we're measuring. I think being able to measure the efficacy of treatment is really important, actually. I find, I called my first book, Making Babies, a 3-month program for maximum fertility, because Dr. David and I, Dr. David was my co-author, he's a reproductive endocrinologist, felt that it took 3 months to make differences in people's cycles. So it takes 1 month to kind of understand what someone's doing, and it takes another month to implement solution, and it takes another month really to see that come to fruition. But you should be able to measure progress along the way. So, maybe less PMS would be a good one. Your long follicular phase, maybe we're shaving a day off it or 2 days and things like that. And once, when that's how we assess our treatments and make changes to our treatment planning as we see how you respond. And we share that with you. So we would help you assess the efficacy of your herbal treatment, and we'd be responding to your body's signals and possibly changing treatment here and there. Good
That
question.
can be really helpful to know. It's true, because sometimes we lose sight of the smaller elements in our goal, our larger goal, and it can be really helpful to that frustration if you're not there yet. To kind of see, here are some of the changes we've made, so you are getting closer and you are making progress. And it's so yes. Is your follicular phase a little bit shorter? Is your period a couple of days longer? Are we making shifts that indicate a healthier aspect in your own furthering towards the goal?
Thank you.
Good.
Someone had asked about improving egg health, and I wondered if both of you could speak to some of the steps that people can take to improve their egg health.
Now, you must get this question quite a lot in group, I would have thought, Anne, do you?
We talk a lot about it. Yep.
I bet. Well, I'm going to have you go first then.
Well, there are several ways, actually. Certainly, I can always start with acupuncture and herbs as being really good ways to help with the egg health, because what we're looking to do is really make sure that your ovaries are getting good circulation, the follicles are getting the best nourishment, through blood flow and good nutritional support, and that to give the best health to the follicles that they're developing. So there are ways to do this. Acupuncture is very good at reducing inflammation and optimizing blood flow to the ovaries and really to the whole pelvic area and the whole body. Also, good diet, which we talk a lot about in the group, how to really optimize your diet, getting a lot of vegetables, a lot of proteins, healthy fats. Should you have carbs, or are you having issues with insulin resistance, so you want to reduce the carbs a little bit? We'll get into details like that with your particular cases, and you can talk to us also in any individual sessions as well. But so healthy diet. So there are a couple of supplements I always recommend for any issues with egg health, like CoQ10 and omega-3 are really, really useful. And also to be very careful about inflammatory triggers, alcohol, sugar, things like that. So it's really taking a look at your, aside from the acupuncture and herbal use, it's also taking a look at your own healthy habits and lifestyle habits, and making some adjustments to just make sure you support that follicle health as much as possible.
That was That was a very comprehensive answer, and I agree with it. So I'm going to let
And
you
there's
ask
more
another
to talk about in the group too. Yeah.
Yeah, no, I bet there's I bet you talk about this a lot. It's a question I get a lot too. And there is a lot you can do to help every egg live up to its potential, which is how I see it. Yeah. Emma.
Thank you. I like that phrase of letting your eggs live up to their full
Yeah, I do too. That's good.
So someone had asked, and I'd be curious to see what both of your answers are and if they're the same or different. So one person said, what do you think is the most important tool that someone can use for trying to conceive?
Now, by tool, I don't know what we mean necessarily, but I'm going to say anything that helps timing. Whatever that tool may be, whether it's an ovulation predictor kit or a BBT chart. We get a lot of information from basal body temperature charts, not just when people ovulate, but we get a lot of information. So for us as practitioners, when you keep a basal body temperature chart, it gives us information about your whole cycle and how the transformations and the feedback system that happens hormonally during your cycle is working for you. So timing, I think, and BBT charts possibly.
I agree 100%. I would have said the exact same thing. Just learning to track your cycles, know your cycle as well as you possibly can, know all the details of it.
Yeah, understanding your body is kind of the tool. You know, because we spend a lot of time kind of subduing our rhythms, I feel, for whatever reason, and either on the birth control pill or, you know, just generally we're under pressure to sort of pretend we don't have periods even. And so it leads to a little bit of detachment, and it's actually really empowering to learn how your body changes through the cycle. And for me, it makes me in awe of us as people who have periods, that we have this extraordinary rhythm, which is extremely intelligent. So just to give you an example, when you produce your egg white cervical mucus, that is the only time that your vagina is the same pH as semen. You actually become receptive at that moment, and you have the same, you produce fluid that is the same pH as semen. That just seems incredibly smart to me. And it's worth just getting to know what a miracle your cycle is, and sort of embracing that rhythm rather than trying to fight against it, which is, I think, how a lot of us were sort of cultured. So yeah.
So we haven't talked much about assisted reproductive techniques, but we received a few questions, so I thought I would ask those. So someone was wondering if you had any bits of advice of what you can do to support the IVF process. And then similarly, in terms of supporting the process, someone had also asked is what can be done with less than 3 months of preparation time before an IVF cycle.
Well, there's lots of research that shows that acupuncture increases the efficacy of IVF. But one of the pieces of research that I'm particularly interested in was a big meta-analysis. That's an analysis of lots of different research studies that looked at couples going through IVF, and they gave the female partner acupuncture. One group had acupuncture just around the IVF transfer. One group didn't have any acupuncture at all, and the other group had what we call whole systems Chinese medicine. That means herbs, nutritional advice, everything we've been talking about tonight, regular acupuncture, supplementation. Those people had all of that for 3 months. And it won't surprise you, I think, to hear that the people who had that 3 months of whole systems Chinese medicine had better outcomes. And the next group were the people who had acupuncture around their transfer, and then the people who had no acupuncture. And it was a big study. It looked at over 1,000 couples. So I think that's really interesting. But the 3 months doesn't have to be exactly 3 months. But if we can see you in the run-up, we can get you into a good place to do your IVF. And Anne will tell you that we see this time and time again, you know, that the healthier we get you before the IVF, the more positive the outcome. And it's not a hard and fast rule. Sometimes people go into their IVF with flu or something, and I'm really worried about them, they get pregnant. You know, it's not hard and fast, but we'd like to see you ahead of time. What do you think, Anne?
Well, I agree. I mean, if we have 3 months, great, you know, and if we don't, then we can still help you. Whatever your treatment you get is helpful. I said it before, I think even this evening. So whatever treatment you get is helpful. And as you get more treatment, then those benefits are cumulative. So if you come in and you only have a month before or 3 weeks before or something, we're still going to really help work with a good healthy blood flow, kind of prepare those ovaries to have the stimulation medications and really to respond. It's like to have everything kind of recruited and grow together. I know the study you're talking about, Jill, and it's so encouraging to see that kind of thing. And yes, anything we can do within that amount of 3 months is still very, very useful. And we definitely also sometimes see people who just start coming in as they're beginning the medications, and that is helpful too. So whatever you can manage, then we will work with you, and we'll really will really help you have a successful cycle. If we're putting you on herbs during the time period before your IVF cycle, we'll take you off the herbs for your medicated, the time period where you're medicated, because we don't tend to mix. Occasionally we do, but we tend not to do two things together. But there's plenty that we can do to kind of lead you up to that time. And then once you reach the time of medication, we just really support the actions of those medications.
Thank you. We're coming to the end of our discussion. I have one more question, but before I ask that, I just wanted to let everyone who's tuned in today know that I will send a recap of this conversation and a recording of this event. So don't worry about, I know someone had asked for us to go over the show acronym again, so I will definitely detail that out, and I'll send over this research as well that Jill and Anne have been referencing. And I'll give you more information on the fertility group. We have one coming up on June 14th.
14th, yeah.
Which is actually, it's an intensive, so it's a 3-week session, which I think, Anne, if you want to speak to it a bit more, but we can also give information in the email.
Yeah, I'll just give you a little kind of summary of it. In the 8-week group, we spend a lot of time on many themes. So there's a different theme every week, and we go into a lot of detail, but we also have time in that group for a lot of conversation between the members and a lot of sharing of stories and asking of specific questions. So we cover a lot of territory. In this 3-week sort of summer session, we're calling it, it is going to be less group time, but we'll still have some time for conversation, that's for sure. And it's really going to be more about some of the slightly top lines, without going into as much detail about some of the aspects like fertility types. We'll touch on them without going into the deep details on them, but we will talk about tracking your cycles. We'll talk about nutrition, supplements, lifestyle habits. We'll talk about managing stress, the stress of our daily lives, plus the stress of fertility challenges. We'll talk about working with IVF processes. So lots of information. And you can do just the 3-week if you want. If you really like it and you want to get more into the details and have more of the support network, then we'll be doing another one of those groups in September. But this 3-week one will be a lot of really useful information, and a kind of fun way to spend some Monday evenings together. So a lot of learning.
Thank you. Yeah, I took part in the prior group, and it was just so packed with information and just really, really such a resource. So it's really wonderful that you're able to do another one for the summer.
Yeah, I'm glad.
Yeah. One of the, I guess for the last question, and I know it's something that whether you're trying naturally or through ART, it comes up a lot, which is I guess emotional resilience and handling the stressful side of, trying to conceive, and some people had sent in some questions about this too, and they were wondering what your advice would be on balancing mindsets and setting realistic expectations for fertility, and how to kind of navigate the emotional and the
Yeah.
stressful side.
It's really hard. It's really hard. And Anne and I support patients through this process and have done for a long time. And you should just know that our hearts go out to you. And it's hard because you have to sort of keep going and your hopes keep getting dashed. And so it requires a certain amount of resilience to keep picking yourself up and going forward. And part of our job is holding people's hands during that process, actually, and helping them to keep going forward, because one of the things we know is that most of them will get pregnant. We just have to, keep moving forward, keep solving problems, that kind of thing. Several things occurred to me. One is, I think you need to set yourself a regimen that you can actually do. I think people get very tight about and very strict with themselves. And there are things that are important, and we'll help you decide what they are, but you don't have to just be really brutal with yourself. Do you know what I mean? So if you like a glass of wine, you can have, we'd like you to have 4 alcohol-free nights, days a week, and then, don't binge on the other 3, kind of thing. And so we try and help people to have a fertility enhancing regimen that is something that doesn't cause them a lot of deprivation, because I think it's hard, it's important to see it as a bit of a process rather than just a month by month thing. And you could put up with anything for a month, but just think about that. And that's certainly my focus when I'm helping people adopt a fertility friendly lifestyle, is can they do this over 6 months or 8 months without it making them miserable? If they can't, we need to adjust it a little bit so that it's humane. And the other thing is just to see it as that, as a process, rather than every month being a goal. I try and not I try and stay very steady for the patients, because I encourage them to stay steady. So I don't go up and down. I encourage them not to go up and down. And that's Anne's nodding, because that comes with experience. So for instance, we can sometimes tell that people are pregnant from their pulse. I don't say that.
No.
Ever. I think, I think this patient might be pregnant, but I don't say it because I'm trying to keep everything very steady so that they can, in the case they're not pregnant and they got their hopes up and things like that. So we try and help you manage your emotions. It helps to have support. I think that's why the group is that's why they continue to meet, these groups, when we're finished doing the coaching, because it's helpful. This is often a private journey that you're not sharing with many people, and therefore you don't get support. And I understand why you don't tell people, because you don't want everybody looking at you. Are they pregnant? Are they not pregnant? That kind of thing. And the weight of everybody's expectations makes all of this worse. But it's helpful to have someone who is supportive in your life. And we certainly play that role for a lot of people. The feedback we get at Yinova when we ask our patients what they love about us is, they often say, my acupuncturist was the only person apart from my husband who knew I was going through this, and they helped to pick me up on the bad days and things like that. So it's our intention to give you support. But it's a really good question. It must come up in group, Anne. What do you tell people?
That too, it certainly does. And I agree that, we need to see this as a process, because so many women feel like they've failed again at the end of that month because they get a period or something. And it's just such, it's heartbreaking if you see it that way all the time. And I understand that people do, and people feel like a sense of betrayal, that their bodies are betraying them. And so, we really want to keep them supported and lead them through and help them see what the progress is, and help them, feel sad when they feel sad, and then move through that and back into the next phases of things. And in the groups, I think the shared experiences, they're different, and yet they're very relatable for each other. It's really helpful, and the opportunity to have a group that is, supportive in talking about them and safe. And we have conversations about how to navigate that world, you know, where people are watching if you're having a cocktail, or people are asking you why you're not drinking, or people are, you know, like there's a lot of boundaryless behavior out there, and how to kind of script your way through it, and you know, feel like I can be in public and I don't have to hide just because I'm not behaving the way that I used to, you know, because I'm not drinking as much or doing that. So there's a lot of support in you know, helping you manage that social situation. Plus, of course, we have ideas for meditations and visualizations and ways to kind of handle the day-to-day stress, and helping you get to sleep and helping you restore. So it is difficult and it's challenging, and it's something that you want to have some tools. You know, somebody asking about tools, these are important tools too, you know, to really help you through those times where you just feel so let down and betrayed and frustrated.
Thank you both. So we're at the end of our discussion, and I just wanted to thank you both, Anne and Jill, for your warmth and compassion and your wisdom. And it's been really lovely to speak with you. And I personally, I help with these events often, and I always leave them learning more than I ever thought that I would. So thank you so much for sharing all of your wisdom. And it's been so nice to spend time with you both.
Yes, we used to all be in the same office, and now we've all been apart. It is a joy to spend time with both of you and with the Yinova community. Thank you so much for listening and asking such interesting questions. We love our job. You can probably tell that Anne and I love our job. It's a very satisfying job.
Could talk another couple of hours if we had. And yeah, thank you everyone for checking in and asking those really great questions. And I hope to see some of you in our upcoming group.
Yes, take advantage of that quickie intensive group, and you can chat to Anne in more depth. But until next time, I'm going to go off and have my dinner. I'm sure a lot of you are going to do the same thing. Thank you, Emma, for hosting. Definitely. And we will see you next time.
Yes. Good night, everyone.
Good night.